Hello everybody, my name is Amanda Victoria and in this video I'll be demonstrating about bed shampoo. So why does someone needs a bed shampoo? It is because some people needs to wash their hair in bed due to limited mobility. So when someone isn't able to get into bath or shower, it can't seem to possible for them to keep their scalp clean. So why is hair care important in nursing? It is because it is an important morale of a patient and it stimulates the circulation of the scalp. It helps to remove any bacteria, any dirt in the hair. At first, you would need to assemble some equipment such as some towels, shampoo or conditioner, a basin, a waterproof covering for pillows, some small empty pitcher or cup, and a comb. At first, you should fill the water into the large pitcher and check the temperature of the water. The water for bed shampooing should be 40 degrees Celsius. Firstly, you would want to place a large empty basin or bucket on the floor just under the patient's head. Next, you would want to place some waterproof sheet under the patient's head, but in my case, unfortunately, I didn't have any waterproof sheet, so I just used a plastic bag and towels under the patient's head. And I placed a towel to cover his eyes and his chest area. This step is to ensure the patient's comfort and to prevent any water from splashing his eyes or nose. I didn't have any gloves on me, but it's always important to wear gloves when dealing with a patient. Then, you should start examining the patient's scalp and determine if the patient requires any special treatment, for example, if there's a case of lice. And before you wet the hair, recheck the temperature of the water in the basin. Then using a small pitcher, wet the patient's hair with warm water and squeeze a small amount of shampoo onto your palm, and then you should massage it onto the patient's head. You should massage gently and apply pressure according to the patient's liking. You would also want to shampoo the patient's hair from their scalp to their hair ends. Once you're done shampooing your patient's hair, rinse thoroughly the patient's head from the hairline to the hair tips, and keep rinsing until the patient's hair is completely free from shampoo. Then, you can also add conditioner according to your patient's liking. And then, rinse the patient's head again until his hair is completely free from conditioner. Lastly, dry the patient's hair with clean towel and assist in combing their hair. Remove the protective covers and allow the patient to rest undisturbed.